my record. And just to confirm, everyone should be able to see my screen now. So like Kirsten said, today we're going to have a conversation about pertussis. So let's go ahead and get started. Funding for this presentation was provided by the Kentucky Department for Public Health. There is no discussion of any product at all, and there's no financial interest or other relationships with manufacturers or products, and no commercial support was provided. So pertussis is an old illness. In fact, it was described by Deblois in 1578 as what was thought to be the first pertussis pandemic. He said its symptoms are severe. The lung is so irritated that at every attempt to expel the cause of his distress, he can neither inhale nor exhale. The sufferer seems to swell up and, as if about to strangle himself, holds his breath. And so obviously that indicates that pertussis symptoms we are for sure to have seen a very long time ago. Um, Deblois also suggested that the coughing illness affected children from ages 4 to 10 years, and those as young as a few months old were significantly impacted. In the 20th century, pertussis was one of the most common childhood diseases and a major cause of U.S. childhood mortality. Before the availability of the pertussis vaccine in the 1940s, public health experts reported more than 200,000 cases of pertussis annually. So what is pertussis? Pertussis or whooping cough is a highly contagious acute respiratory infection. The pertussis pathogen produces toxins that are able to alter the function of the respiratory cilia, thus allowing the bacteria to reach the lung tissue. Cases occur year-round, but past trends suggest that cases may increase actually in the summer and fall. It is caused by the Bordetella pertussis pathogen, which is a gram-negative aerobic bacillus, and humans are actually the only known host. It is one of the most highly communicable of all infectious diseases, and it's really easily transmitted from one person to another via coughed aerosolized droplets. Neither infection nor immunization provides lifelong immunity. And that's really important in the need for continued boosters or frequency of vaccination amongst pregnant peoples. The disease may occur at any age, but it typically manifests most severely in infants and young children. And in this population, it's potentially life-threatening. So the infection itself can be asymptomatic or symptomatic and produce symptoms ranging from mild to severe. And we know that adolescents and adults are more likely to have mild illness that resembles really like an upper respiratory tract infection or an acute cough illness without the textbook symptoms of that whoop or post-tussive vomiting. And so that is a key factor because it kind of makes diagnosis a bit challenging and not always timely because it may look like other illnesses such as just bronchitis or a different respiratory illness, flu, RSV. About 1/3 of infants, however, younger than 12 months of age who acquire pertussis do require hospitalization. And it is most common amongst those infants 6 months of age. Additionally, pertussis can be most severe for infants under 2 months of age if their mother didn't receive the Tdap vaccine during pregnancy. Hence that recommendation that pregnant peoples receive the vaccine with every pregnancy. Unvaccinated or incompletely vaccinated infants younger than 12 months of age had the highest risk for severe complications and death. Pertussis also produces this prolonged cough, and it is a characteristic cough of the illness, and it is very severe, and it can last for upwards of 10 weeks. So that's more than 2 months of significant coughing. So, like I said on the previous slide, pertussis is highly contagious. Sources say that pertussis has an 80% attack rate among susceptible household contacts. Excuse me, a secondary attack rate. And so, a secondary attack rate is actually the measure of how easily an infectious disease spreads within a close-knit group, household, dorm, or other like classroom defined setting after the disease is introduced by the initial case. And so that is pretty high. So one person within a family unit can have pertussis, and 80% of those peoples that were exposed within that group are likely to develop pertussis as well. It kind of has a circular pattern. So adolescents can acquire pertussis from the community and household contacts. Children in school can transmit pertussis back to other siblings, adults, and other children, school-age children. And then infants ultimately acquire pertussis from adults and adolescents. It is improbable or less likely that an infant is giving pertussis to someone else. Since adults and adolescents may develop milder symptoms and diagnosis may not always be timely, there is a potential that the spread can be prolonged because of that decreased timely diagnoses. So pertussis, unfortunately, has a really long disease progression. And I think this timeline here from the CDC nicely shows this. You can see that there's the incubation period, a catarrhal stage, proximal stage, and then the convalescent stage. And so pertussis has an incubation period that can be up to 21 days. It's typically 5 to 10, but it can be up to 21. And this is the period of time that an individual has been exposed. They're not showing any signs and symptoms, but they could potentially become infectious. And this is a relatively long period of time, particularly when you think about other respiratory illnesses where the incubation period might be 48 hours to 5 days. And so 21 days is actually a really long time to have a period of incubation. So the catarrhal stage, that's what happens in the beginning. So that's that first 1 to 2 weeks. The individual is going to have runny nose, sneezing, low-grade fever. Though interestingly, fever isn't one of the most common of symptoms with pertussis, but they're probably going to have a mild cough. They're not going to start with that whooping cough. Apnea and bradycardia in infants is really quite common and is typically the way that infants will show that they are in fact infected with pertussis. And it may be the only symptom actually that infants have. They may not present with a cough. And there's a number of reasons for this. Infants don't always present with a cough for many illnesses that coughing is common. Individuals then progress to the paroxysmal stage, and this is where individuals will experience those severe spasms of cough. They're going to produce thick mucus. It's when they have those whoops that are part of the coughing. They may have vomiting, which is typically associated because of the thick mucus and the severe coughing that's associated with pertussis, exhaustion, and just prolonged illness. Frequently, these coughing spasms will happen at night, really contributing to that exhaustion. According to the CDC, individuals could average up to 15 attacks per hour, and they increase in frequency during the first 2 weeks of that catarrhal stage, and then they gradually, during that paroxysmal stage, and then they gradually decrease. The final stage is the convalescent stage, which can last from weeks to months. And at this point, individuals are going to experience gradual recovery. They'll have less frequent coughs and less severe coughing. Individuals are most infectious through the catarrhal stage through the 3rd week of onset of symptoms within the paroxysmal stage, or 5 days after the start of effective therapy. So if they're on effective therapy and that 5 days of effective therapy has been completed, they're not considered to be infectious, or after essentially 3 weeks. And the duration is around 6 to 10 weeks as a whole. There are significant complications associated with pertussis. However, among adults and adolescents, the complications really are going to increase with age or with the individual's immune status or other comorbids. But complications for adults and adolescents really include syncope, weight loss, sleep disturbance, incontinence, and rib fractures that are typically caused by that intense cough and pneumonia. And as we discussed a little bit earlier, the complications for infants is actually much more significant. And these complications can include pneumonia in about 22%, apnea in about 68%, and then which those are considered to be the most common. And then the other complications, including pulmonary hypertension, these coughing spells that can actually lead to conjunctival hemorrhage, hernia, hypoxia, acute respiratory disease, and death. Case fatality rates are not very high, but they're approximately 1.1% in infants younger than 2 months of age and 0.1% in infants 2 to 3 or through 11 months of age. And so really not a mortality, thankfully, at least in modern medicine, is not very high, but the complications you can see are quite significant. Testing for pertussis is the same as the testing for many things. PCR is the most common. It provides those rapid results. It gives great sensitivity. Culture is still done. Obviously, you'll be able to see exactly what is growing. The challenge with culture is the time. So there could be a delay. And then serology to see, does somebody, had they been, are they currently infectious or have they previously been exposed? There are obviously treatments for pertussis. This includes azithromycin, which is the drug of choice for most groups, or individuals can have any of the other antimicrobials you see there, clarithromycin, erythromycin, or trimethoprim sulfamethoxazole. Treatment, however, does not decrease the length of the illness. It just prevents it from being communicable. So when they get treatment, they may not need to isolate any longer if they have completed that effective therapy. However, it does not mean that their symptoms or the way the disease progresses itself is necessarily going to change. So they're going to continue to have those horrible coughs and the like, even with treatment. And then with this particular illness, post-exposure prophylaxis is recommended for individuals that have been exposed, and we'll talk about that on this slide here. I included this slide not because I think that you guys are going to be able to read the table and know exactly what it says, but to let you know there is a beautiful table available through the American Academy of Pediatrics Red Book that speaks to treatment and post-exposure prophylaxis. Generally speaking, household contacts will receive prophylaxis regardless of their immunization status. And as it relates to healthcare workers, post-exposure prophylaxis is recommended even if the individual has been immunized with the Tdap vaccine. For those that have been exposed and are likely to expose patients at risk for severe disease, so thinking hospitalized neonates, pregnant women, some other high-risk populations. And then other healthcare workers should receive PEP or be monitored for 21 days, depending upon the patient population that they serve. Other exposures, including large group settings such as schools or daycares or something of the like, are assessed according to factors such as community transmission, what was the population involved, how long was the potential exposure, and other criterion to decide who would need post-exposure prophylaxis in those settings. But immunization does not, because a person was immunized does not mean that they will not receive post-exposure prophylaxis. So let's talk a minute about the pertussis vaccine. The vaccine was first licensed actually in 1914, and by 1948, the DTP vaccine was licensed and was really widely used. There were concerns about the DTP vaccine efficacy and some side effects or vaccine-related events. And in 1991, the DTAP was licensed. In 1997, this vaccine was recommended for infants, and then additionally in 2006, the Tdap vaccine was recommended for teens due to waning immunity and increase in incidence of cases. This is a nice infographic here that was provided by the CDC that gives pertussis vaccination recommendations. And you can see here that young children should receive the DTaP vaccine at 2, 4, and 6 months, and then an additional vaccine at 15 to 18 months and 4 to 6 years. So ultimately, five vaccinations. Preteens should receive that Tdap vaccine, and that's typically administered between the ages of 11 and 12. And then a Tdap for pregnant women is recommended during the 27th to 36th week of each pregnancy. And then Tdap for adults is for anyone who has not received that vaccine at any time. And so this is recommended for parents of or partners of pregnant women when they receive their vaccine prior to the child being born. So we know that the vaccine works, and this slide really helps to illustrate that. You can see the trend going down once the recommendation for the vaccine began in the late 40s. There was a slight trend up in the early 2000s, and this prompted the recommendation for an additional booster. However, you can see that there's been moderate increase over time, with the exception of the time period during the pandemic. And there are several factors that may have or are contributing to the increase in reported cases, which could be improved recognition of pertussis by healthcare providers, greater access to and use of laboratory diagnoses, increased surveillance and reporting to public health department, and then waning immunity from the acellular pertussis vaccines. In 2024, reported cases of pertussis increased across the United States, and data shows that that more than 6 times as many cases were reported in 24 compared to 23. And the number of reported cases in 2024 was higher than what was seen in 2019 prior to the pandemic. And so that pandemic timeframe, we know a lot of things really decreased or went away. And so we're showing that we're higher than we were even prior to pandemic starting. Fortunately, the reported cases of pertussis have trended down since that peak in November of 24. However, there's preliminary reports that it actually remains elevated in 2025 compared to immediately before the pandemic. So while not as high maybe as in 24, certainly not as low as we were prior to the pandemic starting. This graph shows the pertussis vaccination coverage amongst kindergarten students in Kentucky compared to the United States. So Kentucky is that brown line and the United States is the blue. And you can see that there has been a trend down during the pandemic. And while we have recovered from that low point in that 2020, 2021, 21-22 school year, it's not back up to what was the pre-pandemic rate. So for the state of Kentucky, for the 23-24 school year, we were at about 91% vaccination amongst kindergarten students, and the United States as a whole was at 92.3%. So we're a bit below the national average. Now, this graph is interesting because it shows the percentage of kindergartners with any exemption from one or more vaccines by school year. And you can see that this has had a steady climb up. Now, I will note that this is not just for the pertussis vaccine. This is for any vaccine, so the Hep B, MMR, polio, varicella. However, it still shows that we were, you know, at a steady incline, and we are really, really, really going up even after 2021 or 2020, 2021 decrease. Again, Kentucky's the brown line, United States is blue. For the state of Kentucky in 23-24, the rate was 2.3%, and the US rate is 3.3%. So we are less than the United States, but still trending up. Also of note, non-medical exemptions account for more than 93% of reported exemptions and for almost 100% of the increase in national exemptions. That is an interesting trend that we'll have to continue to watch. So this table is from a new study that was done by Vesteven et al., and it was actually just published in July of 2025. So participants were recruited from a nationally represented panel of U.S. adults, and eligibility was limited to English language survey takers and those aged 18 years and older who self-reported pregnancy and parent status. There were 174 pregnant participants that were either nulliparous, i.e. their first pregnancy, or paraparous or paris pregnancy, greater than one pregnancy, and 1,765 parents. The participants whom were pregnant were asked about vaccination intention for their child after birth. And so they got asked a question, will your child receive any vaccinations after birth? And they had the option to say yes, no, or I don't know. And those that responded yes were asked, do you plan to refuse or choose not to get one or more recommended vaccines? And this included seasonal flu and the COVID-19 vaccine for your child after birth. And then they additionally asked, do you plan to delay or space out any of the recommended vaccines for your child after birth? And those were all yes, no, or I don't know answers. And the parents were asked the same question, just rephrased to assess vaccination for their youngest child. And I want to note that while many participants said they would accept all vaccines, so that's the grouping at the top, there was a high percentage of undecided amongst pregnant individuals, particularly those that were nulliparous. And this really begs the question around processes needed around education of vaccination during pregnancy. And so you can see there that there were a number of people, about 25% said, parents of young children said they are going to refuse some of the vaccine. There peoples that had 106 said the been pregnant before group said that they were going to delay vaccine. But really that undecided group has a pretty large number of peoples in it. So looking at pertussis from an infection prevention perspective, it's generally like many other respiratory infections, right? Droplet precautions needed for the duration of illness or until completion of effective therapy. Hospital cleaning is done with an EPA-approved hospital disinfectant. Pretty traditional. However, there is the recommendation of post-exposure prophylaxis that we discussed earlier. That is obviously not typical of most respiratory illnesses. And additionally, the exclusion criteria is relatively long, particularly for those untreated individuals, and then what you're going to do for that incubation period that can be up to 21 days, and those peoples that don't take post-exposure prophylaxis. So in conclusion, pertussis is not new. It's been around for a very long time. It has caused disease for a very long time. It is highly communicable. Like I said, an 80% secondary attack rate on household contacts is pretty high. It can have significant impacts on infants, and many of them require acute care of some type. And there is an effective vaccine available for the prevention of pertussis that is recommended for multiple age groups to help to prevent ongoing spread. Here are my references. And then, of course, please follow us on social. Any questions for me? All right.
It's like you got a hand clap from Dr. Wild.
Oh, thank you, Ashley. All right. Well, thank you all very much. One bit of housekeeping. So we are going to be sending out new invites for the grand rounds. Since we're only doing them once a month now, it will be an invite for each month. I found that when I've done them as series, the series gets messed up or links get weirdly messed up for reasons that are not entirely clear. So I will send that out to everyone through a calendar invite. And then, of course, it will be located on our website as well. All right. Thank you all very much. Have a great rest of your day.